Hello and welcome to the newest edition of Pharma Talks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And today our topic is consumer-driven healthcare. Now, we know what consumer-driven anything is because our whole market is consumer-driven. But what does it mean in regards to healthcare?
Yeah. I brought this topic up because it's very common that people are talking about it in the community. And the question is, we have healthcare, and people talk about having healthcare for all. They talk about having consumers, having greater choice. And the question is, who are the consumers? Because today we have healthcare that's provided by employers for people who are working. We have Medicare for elderly. We have Medicaid for people with disability, low income, and we also have care for children under the CHIPS program.
Right.
We have workers' compensation, obviously, for people who are hurt. Bottom line is that there's even more ways of dealing with healthcare in the United States today. But then you ask the question, what's consumer driven? And we have currently all of these different kinds of healthcare.
Right.
And the question is, who are these consumers and what do they want? So in this discussion, we thought we'd focus on what do people mean by consumer-driven healthcare, and more importantly, what is it that people want when they already have all these different sections? We're not making a value judgment that the system is good or bad.
Right.
We're just talking about what is everybody talking about.
Yeah, we're not really the rebellious type. Not the system, man. But it's more of what are the demographics in terms of what the insurance companies are going to look at, right? They have certain demographics that they expect as far as what they're going to take in, what they're going to deny. So we're going to look at some of the demographics of these consumers when it comes to healthcare.
Right, and we have a group of millennials that work for this company who are probably going to start throwing things at me soon because I bring that up to them. And I ask them what is it that people are thinking. But having said that, so I've written about it, and I think Em will attach some of the stuff that I've written to this for it. But one way to approach this is Deloitte and Touche, a large accounting firm, came up with a fundamental concept about what people want out of healthcare. So it's not the only way to do it. It's certainly not. It has been done by generational kinds of things.
Right.
But more importantly, we thought we'd use that as an example to try and talk about what people want out of healthcare.
Right, and just a quick side note for you. Whenever you say millennials, just be careful the way you phrase it. It might have a stigma attached to it. So just let's avoid the generational conversation now. But okay, so you mentioned Deloitte. What are these classifications that Deloitte has?
What they did, and once again, it's only one example, but what they did was to kind of divide the world up into four kind of people. One group was called Trailblazers, a second was called Prospectors, a third was called Homesteaders, and a fourth Bystanders, which are vague enough and general enough that nobody understands what any of that means. So let's try and put it in the context.
Okay.
Trailblazers are young people. The Prospectors are the second youngest group. They have higher income than the Trailblazers, so we're still dealing with youth. Homesteaders, on the other hand, are the second oldest. So we move from the youngest with Trailblazers, then Prospectors, then we move to Homesteaders that are older kind of people, not young people like me, but older people like yourself.
Right.
And the Homesteaders are generally lower income. And we finally move to Bystanders, who are the oldest and the poorest group. So we start with Trailblazers and Prospectors that are young, move to Homesteaders and Bystanders who are older. What does that mean? What do these labels mean, and why do we care? Right?
Right. Well, we want a simplified version of how to look at the world, right?
Right.
Young guys like myself.
Of course.
Tech savvy.
Tech savvy. If they only knew.
Well.
Alex Hernandez, in the tech department, so that everybody knows his area of expertise.
Well, let's stick to Deloitte. Trailblazers is actually a really cool name. Just attach Trailblazers.
I'm glad you like it. Okay, Trailblazers are the youngest.
Uh-huh.
They have a bit higher income. They are in general in excellent health. These are probably the people that people talk about, even in politics, that they talk about where why should they buy all the healthcare insurance because they're in excellent health? So why pay money for premiums? Why pay money for rising cost of care? Because they don't need it. So
Right.
in general, these are the trailblazers and what it is. And the question is, what do they want? These are the kind of people who are tech savvy. They're self-directed. They are engaged in wellness programs. So they care about losing weight, getting exercise, watching your diet, that kind of thing.
Hiking,
all that kind of stuff. They share data because they're tech savvy, right? Yeah. And
they take Instagram selfies,
probably. Probably. And in general, the report cards that are up on the web, in the newspapers with regard to how good are hospitals, the top 10 hospitals, the top 10 doctors, the top 10 whatever, they look at those things and they tend to judge healthcare based on that. So we've got younger, high income, tech savvy people who are self-directed and are interested in wellness, but what they want is to try and lower their overall cost of care because they don't use much. That's the first group.
Okay.
Second group are the prospectors. These are also young people, the second highest. They also have high income. And in this particular case, this group is very open to more technology and to wearable technology, not just watches that have information, but even sensors on your body that deal with your blood pressure and diabetes, some of the things you see on TV with regard to sensors for use with certain anti-nausea drugs, for cancer and things like that.
Okay.
They do, however, take recommendations from family and friends. So where the trailblazers are looking entirely to technology for answers, the prospectors are listening to family and friends. They are dealing with their providers, and in this case, their providers are their trusted people. So prospectors go to a doctor, they trust what the doctor has to say,
right,
and they do whatever the doctor says. So the doctor says to use a brand name drug, they use a brand name drug. If the doctor says that you have a particular problem and you have to do this, they'll do it. Different from the trailblazers, who would do whole Google searches and try and find out what the best ways to do it are. And at the same time, they are willing to use technology, but they're not married to technology like trailblazers.
So trailblazers are a little more naive, a little bit more self-centered, a little bit, you could
Possibly.
say. And then prospectors are a little open to discussion, and they're open to technology, but also open to listening to advice.
The key feature here is that these are people in general who are healthy, who in general don't want to spend a lot of money on healthcare premiums and buying healthcare because they're healthy. And we have some distinctions between the use of technology and their dependence on family and friends and their providers. But either way, even if we get kind of trivial about it, these are people who are looking at the world and are saying, I'm healthy, I'm not going to spend a lot of money today. If I get older, then I'll spend the money, but not now. And that, of course, is a major issue in what goes on in healthcare, because as we've spoken about over and over, the law of large numbers says more people have to throw money into the pot to pay for those people who are sick. If you don't have these younger people in the pot, you begin to have problems.
And the only reason that it's coming to this problem is the sick population is increasing.
Yes, it is.
So,
and the number of people who are obese is increasing. The number of people with poor diets is increasing. The number of people who are generally sedentary, don't get a lot of exercise, is increasing. So that population is kind of a petri dish for having more medical problems.
Right.
And they're not into prevention versus the Trailblazers and the Prospectors who are into general wellness programs in order to try and prevent disease. That's the younger people coming up, okay? Now we move to the older group. The older group has Homesteaders and Bystanders. The Homesteaders are, in general, an older group. They are low income. Women in general are more men with regard to utilization of health care and what they're interested in. They're not open to technology, and their wellness is based on convenience and how much they spend out of pocket. So if there's a large out of pocket, they're not going to be happy. But when they have a provider, they don't change them. Whoever it is, they stick with them. They stay with them forever. They're reserved, they're cautious, they're traditionalists. Bottom line is that these are people who don't have a lot of money. They need a lot of care. They need to have health insurance. But at the same time, they're not open to a lot of tech kind of solutions. They're not open to a lot of wellness solutions, things like that.
Like
and
when they get on the phone, they want to talk to somebody, and or else they're going to get mad and they don't want to press a bunch of numbers.
That's absolutely right. And they're heavily driven by money, out-of-pocket money. Okay? The last group are the Bystanders. These are the oldest. They're, in general, the poorest. Once again, women outnumber men with regard to health care. They're not open to tech. They're not open to wellness. They don't share information with the doctor. Okay? In that particular regard, they're least likely to follow a healthy diet. They choose doctors on how much they have to pay, what's out of pocket, and convenience. In general, if a doctor tells them something, they're compliant about it. They don't go to tech. They don't use tech in order to come up with solutions. They're very resistant to change and unengaged. So what do we have here? What is this? We've got young people who generally have higher incomes, who are tech savvy, wellness savvy. We move to older people who are less income, very conservative, less moving to change. But when you look at this from a healthcare system, the older people need healthcare insurance. The younger people don't, and now we're based on the fact that how you've got to come to an accommodation, because if we're only going to pay for the older people, they're broke trying to deal with the healthcare. And because, as I've indicated, obesity is increasing and sedentary lifestyle and poor diet, etc., is increasing. More and more of the people begin to look more like older populations, even if they're not older. The younger people are tech savvy, and the question, if you look at this and you look at the world and you say, how many people are in these groups? About 16% of consumers are Trailblazers. They're in that younger group. The Prospectors are somewhere around 30%. So if we look at about 46%, or about half of the world, is in the younger group of Trailblazers and Prospectors, and they're the ones that are coming in order to society, lead health care, etc. The Bystanders, the older group, is somewhere around 14%, and the Homesteaders are about 40%. So effectively, young is about half, older is about half. Tech-savvy people, higher income, lower income people need health care to what goes on. At the end of the day, our problem is that when you talk about consumer-driven care, you don't have one consumer. You don't have one demand. You have multiple demands. And the problem is to try and figure out, how do you comply with healthcare that requires so many different demands, even more than what we have today between employer-based and Medicare and Medicaid and all these other types of insurance programs. We have multiple people. Technology is adding another complexity to it, but either way, consumer-driven healthcare is not a monolith. It's not one group of people that think the same way that want health care. It's a lot of different people, a lot of different options, and how they all want it.
Which is why it's so hard for like Congress or for anybody to try to come up with a solution to this healthcare problem that we have right now, where you have the older population and the lower income not being able to support their own medical bills or being able to afford the whatever prescription is out now, and the lower income that can afford it don't need it and don't want to have to pay for it. It's a really tough situation.
Yes.
So, but like I mentioned with Congress, the Congress in the states trying to model healthcare as like the ACA or some alternative to ACA. Well, what do these patients have to? What is there to consider?
Yeah, I guess at the end of the day, because consumer driven is not one consumer,
Right?
because there's options. There have to be more than one option about how to treat these people.
Right.
But everybody has to be involved. I don't mean Medicare for all. I don't mean healthcare necessarily for all, although there are certainly arguments for and against it. What I do mean is that we cannot just treat people that are sick. The issue today of pre-existing conditions, which is really chronic disease, you can't just treat them only. So there are several options. One is to have what we have today, but offer some additional options. A third is to try and bulk up, meaning have multiple states come up together to try and deal with insurance. That's been tried in the past. It has not, the data indicates that it has not been successful, but it's certainly worth looking at again. There are certainly political issues. Democrats don't like it, Republicans do, but when we get away from all of this stuff, one option here is to take a look at it where you have multiple states acting, because multiple states can act as more of a reinsurer. They can deal with the really sick people more than can the younger people, even though the younger people have to be part of the mix. A second option is to have a per capita dollar value that everybody is placed.
Right.
Maybe the younger people have less of a per capita, the older people have a greater amount of per capita. Somehow states, federal government, etc., are going to have to come up with ways in order to fund some of the additional per capita amounts, but then everybody pays in. So there is some sort of an option of how to do that, and there's many ways to handle that.
And I think another problem is not everybody looks at it the same way. Like, say, we use Deloitte as an example for today.
Yes.
To try to help simplify who the consumers are. So it's not to say one Congress member is looking at it this way and trying to model a healthcare system built around that. And then another congressperson is going to look at it and they have a completely different viewpoint. They're not going to agree with this viewpoint. How can you get everybody into the same page?
You're not going to. I mean, clearly just talking about the four groups of consumers, we have four different groups of consumers.
Right.
The older group is not going to listen to the tech-savvy group. They don't even understand technology.
Right.
So just coming up with the fact that, well, maybe you could have a sensor on you that measures your blood pressure or your diabetes and registers and sends that to the doctor so that they know when you're in trouble. The older people look at that and say, I don't even know what you're talking about. I don't know how that works, right?
You're not in that category.
No.
No, absolutely
No.
not. No.
I run a bunch of technicians and programmers. I mean, but
of course, you understand all of us.
Yeah, of course. But the bottom line is that people have to talk about what their needs are.
Right.
They have to talk and sit down and talk with the people that don't agree with them. They need to talk about what the options are and what people need. And they need to talk about the pros and the cons. Because even healthy people get into conditions that are not healthy, whether they hurt themselves, break a leg, get into situations where they're in a car accident, God forbid, or something like that. Healthcare can be switched just like that, and they have to address it. So that has to be looked at. there also has to be issues where they're looking at how do you get everybody involved some way so that care is not the same for everybody. The person who has had a heart attack has a different level of care than the person who is totally healthy and runs 5 miles a week.
Right.
They're totally different situations. But either way, they both have to be involved. This one has to give some understanding of what the younger person needs who's healthy, and the healthy person has to understand some needs of that. This is not an easy solution. It's not a one-trick pony.
Mm-hmm.
It's not where everybody will just come together singing Kumbaya and somehow that everybody is going to be happy. But at the end of the day, people need to understand what the conditions are. They are looking to the government certainly to be, if in the very least, the reinsurer. So if people get really sick, they're looking to governments, state governments, federal governments to cover the cost of that. And the younger people perhaps involved or trying to have some argument about whether they will be involved or otherwise about what happens. And clearly today, states do pick that up through certain counties. They have county hospitals that deals with poor or people who are uninsured.
Mm-hmm.
And they also have counties that deal with care for people who are poor, uninsured, or maybe they had a job 2 months ago. They lost the job, and now they're being taken care of by the county. So things are fluctuate. Like in 2008, when the major recession occurred, people who had jobs, had good jobs, lost them, and now they were thrown on the issues of the county to take care of them, etc. So it's not just this issue about I'm healthy, I'm well, I shouldn't pay anything. There are issues that can happen, and they have to somehow be brought into the system. But at the end of the day, consumer-driven healthcare is about care for a lot of different people with a lot of different objectives, with a lot of different healthcare needs, not just one monolith of, okay, give everything of what they want, or here, give people open access so they can go to this doctor, that doctor, all the rest of the nonsense.
Right.
Because in general, the people who don't need it won't go. The people who do need it go. The cost of the sicker people will rise. The cost for the people who don't need it will not rise. But at the same time, somebody's going to have to pay for it. So counties, states, federal government are all going to have to tax and require.
It's all about the appropriate safety net and how do you build a stable enough safety net to be able to capture everybody.
Exactly.
Right. It's a tough situation, but really all we wanted to talk about in this topic was demographics and who are these consumers and how is it driving healthcare.
Yes.
Right?
Yes.
Right. And if you have any questions at home, please feel free to send them our way. We'll answer them. And if you have any topics or any healthcare questions you might have at home, please feel free to send that in as well. We might center a topic around it because we want to talk about everything in healthcare, right? We want to talk about all aspects of it. And also, what was I getting at? I forgot what I was getting at. I'm lost here, man. Where am I? Huh?
You're getting at the point that consumer-driven healthcare is a nice label, but it doesn't refer to one group or one plan. If we're going to talk about it and we deal with consumers involved, we need to understand that we have multiple entities. It's like owning a clothes store. Some people want some of the clothes, other people wouldn't even think about getting some of those clothes. You've got to have multiple different options for people. Basic options that people can ensure the fact that they're going to get care.
And like how some people like bachata and people despise it. It's
That's a crack
good.
at him.
It's not good, him. It's not. Anyways, yes. Getting back to it, please feel free to send in any questions. I would like to remind you to go to propharmaconsultants.com. Also, was there anything else you would like to add?
Yeah, RxInfoX,
Right.
our information exchange, has the cost of drugs.
Mm-hmm.
So you can go there and see the ticker as it goes by. It's very long because the number of drugs is several thousand.
Right.
So it goes along, and that's available to you, and new news is available to you as well.
Right. And that's my job. That was my project. Anyways, yeah, there's a free information page called RxInfoX that Dr. Stern just referenced. And once again, send messages our way, and we will be back with a new episode next week.